Now from CBS 2 News, this is a special report.
Mayor de Blasio is giving an update on the coronavirus outbreak in New York City. Let's listen in.
Think about the eyes of the world, the eyes of the nation have been on New York City and all of you in this time of unprecedented crisis. When the nation, at the end of all this, thinks about what happened here, when they try and put together the essence of what happened and what New Yorkers did, and try and summarize how New Yorkers confronted this extraordinary moment, I think the simple way to put it will be New Yorkers found a way. Through thick and thin, no matter what was thrown at you, you found a way. New Yorkers, we know, for a long time, for generations, we've been a driven people in the best sense of the word. People who get things done, people who set a goal and then go and achieve it. That's who New Yorkers are. It doesn't matter where you come from, how much money there is in your bank account. It's something we all have in common. And think about the way that folks, even against extraordinary adversity, found a way. Our teachers found a way. Our educators found a way to reach 1.1 million children without the benefit of school buildings and classrooms. Our entrepreneurs found a way to manufacture life-saving supplies and equipment right here in New York City, things that were not built here even just a couple months ago, now being produced in New York City to protect our healthcare heroes and our first responders. And those extraordinary frontline heroes found a way through the toughest circumstances to keep going and keep saving lives. You certainly deserve to know that your city government has found a way and will always find a way, and that's what I intend to do. And all of us here at City Hall and all the city agencies intend to do. So finding a way has taken many, many forms, I assure you. Sometimes things we didn't expect and help from places we didn't expect. I never would have expected that we would need to seek test kits for the coronavirus from Carmel, Indiana, but that's exactly what has happened. And that's helping us now to save lives here. I never would have expected to meet a pair of very, very good guys, EMTs, paramedics from Kalamazoo, Michigan. Drove through the night to come here and help out our EMTs and paramedics in their hour of need. Never, ever would have anticipated the Brooklyn Navy Yard turning back the clock and becoming a wartime factory again. World War II was a legendary shipyard creating the vessels that helped to protect us and save us. Today in the Brooklyn Navy Yard, wonderful people, from the folks who own the companies to the folks who are sewing the surgical gowns and making the face shields by hand, creating those life-saving products for our first responders and our healthcare workers. Never could have imagined any of it, but each and every time New Yorkers found a way. And there have been some areas where it was hard to find a way, to be very honest. Something I, like most of us, didn't know much about: surgical gowns, isolation gowns. When we came to realize how crucial they were to protecting our frontline heroes in the hospitals, we set about trying to find a supply anywhere in the world, only to find that it was very, very difficult. We needed this armor for our healthcare heroes, and we looked under every stone and obviously started producing them right here, but it was nowhere near the number we would need. Well, it often felt like we only had a few days before we were going to run out. That was the reality we were facing. But today, I am happy to share some very good news. And this is one really important piece of the puzzle, because having those surgical gowns is so important to protecting the people who are protecting all of us. And I'll tell you, I want to, as I say this, tell you that the local businesses that stepped up so brilliantly, they're now making 125,000 of these surgical gowns each week right here in New York City. Again, 0 were being produced 2 months ago, 125,000 a week and growing right now. And one company that was part of that, BCI Brands, they've been working closely with the city's Economic Development Corporation. One day, not so long ago, they shared a very important piece of information with the city. They said they had a sister factory in Vietnam that was capable of much greater production. The factory is called Viet Thanh Garments. And we immediately knew we needed this help. Again, we had to find a way, but it was not going to be easy. The logistics were not going to be easy. It was not like getting something from just down the street. This was going to be a whole nother endeavor. And the questions were many. How would we get the massive quantity of fabric needed to create the gowns far away in Vietnam? Could we get the planes put together? We literally had to find 747s to bring these products back. Could we do it all immediately, because the need was immediate? And I want to thank everyone at the city's Economic Development Corporation, because when presented with all these questions, some of which seemed extremely daunting, the answer to each and every one was yes, and they found a way. So we now have, for the first time in this crisis, a large-scale provider of surgical gowns for New York City. Over 1 million gowns are now on their way as we speak to the city. Another 900,000 will be on their way next week, and 3 million more are being produced as we speak. We're sending fabric to the factory in Vietnam so they can make even more. Now, this is something that I have to tell you, we've been measuring our supply of surgical gowns, isolation gowns, and all the similar protective garments. We've been measuring our supply in days. That's how tight it has been, whether we could even get through any individual week. But now, because we have this strong production right here, and because of this extraordinary partnership with the factory in Vietnam, we are now confident that we will have enough surgical gowns to get us to the middle of May. And that's, I have to tell you, compared to any other point in this crisis, that's the best we've been able to achieve. Not out of the woods for the long haul, more to do. And clearly want to emphasize to all the frontline healthcare workers, this is not the ideal standard. We're still operating at that crisis standard where we're providing the PPEs, but we'd like to provide even more. But at least for the first time in quite a while, we can say we have a secure supply for the weeks ahead. And now we can get the hospitals, the nursing homes, what they need on a much steadier basis. And that is very good news for protecting our heroes and helping them save lives. Now, another place where we had to find a way was when it came to testing. Testing, this has been the central issue during this whole crisis. The absence of testing from the beginning, the fact that testing is still so hard to get now, and the unclear, as a charitable term, the unclear role of the federal government, the absence of the federal government as the driving force throughout this whole process when it comes to testing. Remember, testing is how we get to that next phase. Testing is how we get out of widespread transmission of the coronavirus and on to the next phase where we can start to get life back to normal. Testing is key to everything. So, for so long, the testing we had was very limited, and the focus had to be on saving lives in the hospitals, on protecting our healthcare workers, knowing who had the disease, who didn't, who needed to get home or get treatment, who was able to stay at work, and the same with our first responders. But in recent weeks, the last couple of weeks, we finally had the testing capacity and the personnel and the PPEs to actually go out and do community-based testing the way we want to do a lot more of. We finally are getting this to grow into something much more important and bigger at the community level. So just a few weeks ago, there were literally no sites that weren't attached directly to a hospital. Now, there are 11 community sites open. 8 at health and hospitals clinics all over the 5 boroughs, 3 at New York City Housing Authority sites. And those 3 sites are now open at the Jonathan Williams houses in Williamsburg, at the Woodside houses, Woodside, Queens, and St. Nicholas houses in Harlem. So that has been a big step forward. We're now going to go a lot farther. This fits beautifully with what we have to do to build up a much bigger test and trace mechanism. So this is the first of many steps we're going to take. I'm also pleased to announce there will be new sites opening as part of this community testing initiative. 2 more health and hospital sites will open this weekend at the Ida G. Israel Clinic in Coney Island and the Dyckman Clínica de las Américas in Inwood in Manhattan. Starting next week, we will also provide community testing on a broader scale at all 11 health and hospitals, hospital locations as well. So as you can see, this is really growing rapidly, and it is the precursor to a much bigger test and trace operation that's going to grow throughout May. Again, we're here to serve the communities that are hardest hit, and we're going to be growing out from there to reach more and more New Yorkers across the whole city, every community. And I want to remind you, the first priority always is folks who are older and folks who have those pre-existing conditions, and particularly if someone fits both those categories. So more and more testing in the communities that are having the toughest time with the coronavirus, that then will blend into a true citywide test and trace operation reaching into every corner of the 5 boroughs. So when you add in everything that we have planned, we'll go from the 11 sites now to 30 sites, tripling the number by the week of May 18th. So this is now really moving fast. Testing dynamics are changing, thank God. We talked a few days ago about the self-swab test. That's going to simplify things and speed up the testing process. We still have more work to do with the labs to extend lab capacity for that test, and we need more lab capacity overall. This is still the big missing link, lab capacity and the products that go into the lab process, like the reagents. This is still where we need help from the federal government on a big scale. But more and more, since we're finding more and more sites we can use, we have more and more personnel and PPEs we can apply, we're able to use this simpler self-swab test. The expansion is really moving. So 11 sites now will be 30 sites by the week of May 18th. And we'll be able to triple the number of tests given each week. So now we're at about 14,000 tests per week. Again, getting faster the more we do it, more efficient the more we do it. By the week of May 4th, it'll be 35,000 tests a week. By the week of May 18th, 43,000 tests a week. And we want to go a lot farther from there. Now, I want to talk about the way we link up the things that we've achieved so far, getting more and more of the PPEs, getting more and more of the testing, link that concept up with what all of you have achieved by your extraordinary devotion to social distancing, to shelter in place, to the things that have been working. Another piece of this that has clearly been working is face coverings. Talked about this weeks ago when the evidence came in that it was time to tell New Yorkers everyone needs a face covering outside. I want to thank you because overwhelmingly New Yorkers took that instruction and ran with it. When the city gave that guidance initially, New Yorkers really moved fast to take it and make it a part of your everyday life. And it's helped because it helps protect everyone. And again, face coverings means a scarf, a bandana, anything you can create at home, not a fancy medical grade mask, just anything that you can create at home. A lot of people are getting, masks from a hardware store or something like that. Whatever just keeps your nose and mouth covered. People have been doing this really, really well, but we know there's some people that still don't have a face covering and need one, or some people that need to be reminded energetically that this is now a rule that everyone needs to follow. So with more folks going outside, the warmer weather coming, we want to keep limiting the time outside as always. But we know as it gets warmer, people will come out for their exercise. That's fine. Get your exercise and get back home. We want to keep people safe. Everyone needs to have a face covering on. Now, a place where you particularly have to be attentive, and I want to remind people these rules. When you go into a grocery store, a supermarket, a pharmacy, you have to have that face covering on. You have to. You have to do that out of respect for your fellow New Yorkers. You have to do that to help protect everyone. Remember, when this disease is not spreading, it's also protecting you and your family, everyone you love. That face covering helps reduce the spread of the disease. So, you need to do that, and if you don't do that, you're actually putting people at risk. And if you don't do that, we've made very clear to the owners and managers and employees of those grocery stores, those department stores, those supermarkets, those pharmacies, that if someone comes in, is not wearing a face covering, of course, it's great to remind them, hey, you don't have your face covering on, put it on right away, please. If someone doesn't have a face covering with them or isn't willing, they need to get out of the store. Let's be abundantly clear. We've said, and the city will back them up, and if the store owner or manager needs support from any city agency, including NYPD, we will be there right away. No one goes into a grocery store, a supermarket, or a pharmacy without a face covering on. If you try to, the people in the store have every right to send you right back the other way out, and we will back them up 100%. So again, really clear rules, let's all follow them. It's just for the protection of everybody. Now, again, want to make it easy for people to have face coverings. So we're going to start to give them out free in our city parks. We know it's going to get warm. We know people are going to go to the parks. Again, want people to keep some real limits on that, but I want everyone to have a face covering. Sometimes someone just forgot it at home. That we understand. Some people having trouble finding one. Okay, we're going to start giving them out for free. So 100,000 will be given out starting this week, and we'll keep going from there. We're going to focus on parks where we expect a lot of people to be. We're going to focus on communities that have been the hardest hit by the disease. Anyone wants to know where these face covering distributions are going to be, you can go to nyc.gov/face coverings. Now, social distancing has been absolutely crucial. It's working. And another type of heroism has been the quiet heroism of so many of our city employees who have been out there, our public servants, educating people, reminding people that it was really important to practice social distancing. It took some time. It's not normal for New Yorkers. We understand it. It's taken a lot of adjustment, but a whole lot of our city employees have been out there doing a great job educating people, very persuasively reminding them that this has to happen. The NYPD has been in the front line of that effort. I want to thank all our officers who are doing that work and all the members of all our agencies who have been doing that work. Look, we know this isn't easy sometimes, and it certainly wasn't what people thought would be part of their regular job, but we need it, and it's making a big difference. So NYPD's been in the front line of this. We're going to bring more and more other agencies to this effort. And we now have over 1,000 non-NYPD city workers who are being assigned to patrol parks and public spaces. They're from the Parks Department, the Office of Special Enforcement, Sanitation, Fire Department, Environmental Protection, and the Sheriff's Office. So this is a big group. A lot of them have been out there already. More will come, and we're going to keep building this ability to be out there in public spaces, educating, patrolling, but also enforcing. At the same time, these public servants will have a lot of face coverings with them, and they'll be able to distribute them to anyone who needs them for free. Every time we give out these face coverings, I emphasize it will be for free. And they'll be distributing 275,000 face coverings starting this week. So it's going to be really easy to get a face covering, and everyone needs to stick with using those face coverings all the time when you're outside. Now, let's talk about some good news for the heroes who have been doing so much for all of us, our healthcare workers, our first responders. Something very good happened earlier on in this crisis, and I want to thank everyone at CITI Bike. They created something called the Critical Workforce Program. They gave first responders, transit workers, healthcare workers a free month of membership, and 5,500 of them signed up and took advantage of that and were able to get around using CITI Bike. I want to say with great appreciation, the CITI Bike is now expanding this to a 1-year free membership, and it will be offered to an even broader set of essential workers. I want to thank folks at CITI, which provided, and MasterCard, both CITI and MasterCard have provided tremendous support, $1 million to fund this program. This is going to be fantastic for helping people get around who need this alternative. And on top of that, CITI Bike will be expanding with 100 new stations, docking stations, in the Bronx and Manhattan, including key locations that have been in the front line of this crisis, including Lincoln Hospital and Harlem Hospital. And it will help everyone. These new stations, of course, will be open to all, and they'll give more and more options to more and more people. So that's a great, great step forward. I want to thank Lyft, which is a company that now owns CITI Bike. This is a great step forward. Thanks to everyone at Lyft. Thanks to everyone at CITI for investing in this program. And again, MasterCard as well for investing in this program. We appreciate this initiative. This is going to make a big difference. And while I'm giving some thanks out, I'd like to thank some more organizations that have, and it's just wonderful when people step up for New York City. And it really shows that a lot of people, a lot of organizations that have for a long time benefited from their connection to New York City are remembering that and honoring that and stepping up for New York City, and we are very, very appreciative. First of all, our friends at the NBA have donated over 1,000 N95 masks and 30,000 surgical masks. We thank them for that. American Eagle has donated 175,000 surgical masks. That's fantastic. And the Consulate of Egypt has donated 200,000 surgical masks, 3,000 protective suits, and 2,000 surgical gowns. We are very, very appreciative to all. Now, that's in the category of the protective gear. There's been some other great donations. AT&T donated $100,000 to our Food for Heroes effort through the Mayor's Fund. Fresh Cosmetics has donated $205,000 worth of personal cleaning products to our health and hospitals locations and to the isolation centers working on behalf of our homeless New Yorkers. And Facebook, this is really fantastic. Facebook is helping out our small businesses that are going through so much right now. We need bigger businesses to step up to help our smaller businesses. We need philanthropies. We need all the support we can get, and most especially, we need the federal government to keep stepping up and putting real money into supporting our small businesses. But this is a great example, and we're going to be doing more and more of this to get in every conceivable source of support for small business. Facebook has launched a $6.5 million grant program for New York City small businesses specifically. And it is help our small businesses richly deserve. I want to thank everyone at Facebook. This is a great initiative. Any small business owner wants to apply can go to facebook.com/grants4business. Now, on that same note, obviously, the key here is the federal aid. And we know the first round of the federal support for small business, the Paycheck Protection Program, it did not work as planned on many levels. A lot of big businesses tried to usurp the money. It was a hard process to make sense of. A lot of businesses couldn't get their applications in time. A lot of businesses didn't have the relationships with the banks that made it easier. There were a lot of problems that came up in that first program. Granted, it was an important program. It was put together quickly in a crisis. But the good news is that, especially through the leadership of Senator Schumer, Speaker Pelosi, Congressmember Nydia Velázquez, the Paycheck Protection Program got replenished with $310 billion and made more available to businesses that don't have those traditional big bank relationships, businesses that use local credit unions, more smaller mom and pop businesses, community-based businesses, businesses in communities of color. A lot was done to improve the program. So $310 billion, an astounding amount of money, but we need to make sure it goes to New York City small businesses. It's going fast. So again, every small business who needs that help, if you haven't applied, apply immediately. Go to sba.gov for the Small Business Administration, sba.gov. That's where the federal application is. Get it in as quickly as possible. And as I announced, any small business that's having trouble navigating the application process can call 311. And our team at Small Business Services and other agencies will help small business owners to navigate this process, but we've got to get these applications in right away to help our small businesses. So please pick up the phone if you need help. Now, let's go to the daily indicators. This is what we talk about every day, and so important to track them all together. And so today we have a very good day. We don't have a perfect day, but a very good day. And again, I constantly see progress here because of everything you're doing. I want to get to those days where we hit all the notes and keep hitting them, but overall we still see real progress. So daily number of people admitted to hospitals for suspected COVID-19 down 136 to 129. So small amount of progress, but still progress. Daily number of people in ICUs across health and hospitals for COVID-19 down 734 to 705. Percentage of people testing positive citywide down 23% to 22. Again, small progress, but progress nonetheless. Public health lab, this is, again, the toughest measure in many ways, went up, not by a huge amount, but it went up 29% to 36%. So overall, a good day, overall moving in the right direction. Keep doing what you're doing because it is clearly working. So I'm going to close in a few words in Spanish, and then we'll turn to our colleagues in the media, but just want to come back to that notion of finding a way. Again, it's a very New York City idea. It's a New York City way of life. You know, New Yorkers for generations have known how to make something out of nothing, how to take what looked to be impossible odds and turn them around. It's happening over and over and over again in this crisis. It's been amazing to watch. My respect for all you was intense before this crisis. It has grown even more because I've watched this city somehow fight back this disease and do it with an incredible strength and a compassion for each other. That's what New York City is all about. So we're going to find a way. And I can tell you what we're all going to do here at City Hall. One way or another, we're going to find a way to get more testing. We're going to find a way to create the biggest testing and tracing program this city, this nation has ever seen. One way or another, we're going to get those supplies, that equipment that protects our heroes. We will find a way. We will find a way to restart this city, and we will find a way to recover, and we actually will find a way to come back in many ways stronger and fairer and better. I have absolute faith in the people of this city. So we know how to find a way. That's who we are, and we will find a way to beat this disease. Una y otra vez.
You've been listening to Mayor de Blasio give an update on the coronavirus outbreak in New York City. We're now returning to regular programming on CBS 2. For extended local news coverage, stick with our streaming service, CBSN New York.
This has been a special report from CBS 2 News.